Hi guys, welcome back to the channel. By popular request, we've got one of our old patients back.
Hi, I'm Jane. I'm 47. I work in a school and I'm from Kings Lynn, Norfolk.
So, I know you've been on one of the videos before, but prior to that, you've actually had a little bit of other treatments done, haven't you? So, why don't you take us through that?
Yeah. Well, I've had Botox before, which I really like, the look of Botox. And also I've had fillers in, what's this area here again?
The nasolabial folds.
I've had that done a few years ago now, but I found it really sort of worked really well for me.
Oh, was it just there?
Yeah.
Oh.
Yeah, so I really, that sort of never went back as bad as it was in the beginning, so it was really successful. And I also had an ultrasound facial once by you, which was really effective. I got lots of compliments about that, even without makeup on.
That's what we like to hear. That's what we like to hear.
So
the just going back to what you said there about how the line never came back as much as it had done previously.
Definitely.
So that's something that people often say after treatment, because wherever you put filler, you get a bit of collagen stimulation there. So even after like a year or 2 years, people often don't go back to having that same line as it was. And yeah, the ultrasound treatment that you had before, that's one of my favorites. So that's Ultracell. And it basically just heats up the tissue deep down in the skin and gives it some contraction. We didn't film that before. I think that was just, you know, a treatment that you had off camera. And then we did do a treatment as well that we filmed.
Oh
too,
yeah, we had the cheek fillers.
Yeah, that's right.
I love the cheek fillers.
Yeah,
they're really good.
And then this time we're planning to do a bit more. In fact, probably a lot more, actually.
Yeah.
So why don't you run the guys at home through what it is that you're looking to change?
Yeah. I just feel as I've got older, I've lost a lot of the fullness in my face. I feel like my face is almost dropping more, and I feel like the jawline's not so strong, and just sort of hollowness around the eyes, really. Because I always sort of, when I was younger, I had quite a full face, and now, as the years gone on, I feel also that, you know, I like to keep fit. I like to go to the gym. But with your face, with that, you can, you know, you can do it yourself. With your face, you really need help.
Yeah, well, that's what they say, don't they? You've got to pick between your ass and your face.
Yeah.
As you get older.
Yeah, exactly. Exactly. So
but that's fine, because now you can have both.
Yeah, good.
So what I'm going to do is just grab the iPad then, and we can go through that together, and you can just indicate the areas on there that you were thinking that we might do a bit of treatment in.
Yeah.
So let's go over to the iPad. Why don't you just let me know which areas it is that you're not loving?
Here, we've obviously lost fat through the years, and obviously underneath my eye, just again looks flat. And obviously here,
Jawline.
yeah, jawline. And here, when you look at my face, I just feel like there's a lot here.
The marionette line.
Yeah, all around here. It's not good. And also, I never wear my hair up anymore because I just think my profile's awful.
On the side.
Yeah, really bad.
This part here.
Yeah, okay. Around my jaw. I'm really conscious of it. So.
Well, what I was thinking we could do, we spoke before about doing another session of ultrasound treatment, which we can do before we start anything else. And then definitely we're going to treat the temple area, that's for sure. I think also doing a bit of work in this area where there's a bit of hollowing, because it will help to give you some lift.
Okay.
So we'll do there. Underneath the eye, for sure, will really help with that crepiness. It's like crepey skin there. A bit in the tip of the chin, and also the chin crease here. And then the angle of the jaw, because that will lift everything back like this. And you mentioned the marionette zone here as well, which is that area. So 100%, yes, we'll do that too. Did you have any thoughts about maybe doing some hydrating treatment in the lip itself, where the lines are?
Yeah, I haven't really thought of that really, but yeah, that probably would be good.
Because what can happen is, as you put lots of volume in the rest of the face, the lip can sometimes look a bit too skinny in comparison, and then it doesn't look as good.
Yeah.
So we could always do a bit of that right at the end. Okay.
Yeah, I'm good with that.
Excellent. So, let's get to it. So the first thing we did was some ultrasound, which is ultrasound skin tightening all over the face. With this, I tend to only treat the upper part of the neck and the mid and lower parts of the face. Once that's been done, we went ahead and used some Juvederm Ultra 4, using 1 ml per side. Then again, using Ultra 4, 0.5 ml per side with a cannula along the cheekbone. Switching now to Juvederm Voluma and a cannula, the area directly underneath the cheekbone was injected. TSL Ultra Deep with a cannula to the angle of the jaw, 1 ml per side. At this point, we've used 7 mils. Now Juvederm Voluma with a cannula again to the cheek, 0.5 ml per side. And then Ultra 4, 0.5 ml to the point of the chin. Juvederm Voluma with a cannula, jawline to the point of the chin, also up to the marionette area in a fan shape, using 1 ml per side. And then Juvederm Voluma, again 0.5 ml per side to the area just underneath the cheekbone. She's getting a little bit swollen here. Then we use Vol Lift to the base of the nose with 0.5 ml per side. And then the front part of the cheek, 0.5 ml per side, Juvederm Vol Lift. We're now moving up to the forehead and doing 0.5 ml of Juvederm Vol Lift per side using a cannula. This is for the forehead hollows. We're now up to a total of 15 mils. We then switched to TSR Redensity 2 using a cannula underneath the eyes, and we did 0.5 ml per side. Switching this then to Redensity 1, I also did 0.5 ml per side. Redensity 1 is much more of a mesotherapy type product, and it contains additional vitamins and minerals to help support the skin's health. It doesn't really give volume like the Redensity 2 does. I then went for Juvederm Vol Lift with a cannula in the lips. We used 1 ml in total, and also some Ultra 3 to the Glaucocline point and the lower lip middle third. That was 0.5 ml in total. The other 0.5 ml was used in the point of the chin sometime previously. So when I just said it's 15 mils, it was actually 14.5, sorry. Finishing up now using Juvederm Ultra 4 along the jawline. This was also done with a cannula, and we did half a syringe each side. That takes us up to 19 mils in total. We also finished up by doing some Botox in the glabella, around the crow's feet, and also in the forehead. And that's it, we are done. Okay, so here we are, back again. So tell me, first impressions, how did it go? It was a bit more complicated for you than maybe for some of the other people that we've seen so far in the series, because we actually met again probably about 2 weeks ago.
Yeah, it was 2 weeks, yeah.
I think because there was a little bit of irregularity in the chin, so we put a little bit more in. But I'm going to let you tell your story first, and then I'll jump in a sec.
Yeah.
So from the beginning, what happened?
Right, so obviously I had lots of filler. I had cheek filler, the jaw, the chin, which was fine. And then my swelling did take a long time to go down, more on my lower part of the face than my top. My top was fine, except for a little bit of bruising around the eyes, which was fine because I put my glasses on and nobody could see. So that was good.
Where did you get the bruising here?
Pardon?
Where did you get the bruising?
I got the bruising round here, and that came probably about 5 days later, bizarrely. But that was fine because makeup, you know, you can cover well. But it's the swelling really that took the fight down the lower part of my face.
What about here? Did you get the swelling there?
A little bit, but not massively, really.
Yeah.
Just mainly more round here, really. And I was using ice packs to help it go down, and that was quite a slow process.
So we originally did the procedure. Is it 4 weeks ago now, or is that or is it 5 weeks?
5, I think.
5. Okay.
Yeah.
So then we had like a 3-week gap, and then I saw you again.
Yeah. So then, because I felt my chin didn't feel right, so then you added some more.
Because there was a little bit of asymmetry at that point.
Yeah.
And then you swelled up again.
Yeah, and I'm still a bit swollen now.
Yes. So, but off camera, we had a bit of a chat about this because I did notice that there was quite a bit of swelling still in the lower part of the face and in the lip as well. And on touching that area, I feel like it's still pretty swollen. The lip even at God knows how many weeks. It's like 5 weeks since we did that. So it's still swollen. And I was just trying to explain that sometimes this happens to patients. So, 95% of the time things are uneventful and nothing bad happens. But every now and again, you get somebody who is a bit more of a sweller. And like literally this weekend, as I just showed you that picture of me, my lower lip swelled up. I haven't had any lip fillers now for about 2.5 years, I think. And just randomly, when I was at the hairdresser's, it started swelling up, looking like this. And then I just took a bit of Piriton and it's starting to go back down again. So there is this kind of low-grade inflammatory response that sometimes people can have as a result of having hyaluronic acid dermal fillers. And I think we're both kind of in that category of people who maybe, don't do as well as some other people do. I mean, eventually it does go. It just takes a bit more time with some people. Yeah. But it's definitely, it's evident there now. You can see it. Yeah. And we had to take the after pictures today as well. So it's evident in the after pictures. I just think you need maybe another 4 weeks or so to let everything settle. I mean, it will go. Yeah. It's just a bit of time. So apart from that, what about the other bits?
I think my skin looks amazing now, and also, obviously, I do look brighter. I do look better. It's just that I am quite still self-conscious of the bottom of my face, but the top part of my face, I'm really happy with. Really happy, but hopefully soon that'll settle down.
Yeah. It's just time. It's time, guys. And actually, that's quite important because I think sometimes when we have procedures done, we don't always kind of consider, well, okay, maybe that happens fine 95% of the time, but if we're in that 5%, what do we do? How do we handle that complication? Like for myself, when I had my breast augmentation done, numbness is one of the complications that you can have from that procedure. And I'm numb. I can't feel anything like under here.
What now?
Yeah, even now.
Really?
So that's like, God, maybe 3 or 4 years ago that I had that done. And that's just, it's one of those things that can happen.
I didn't realise that.
Yeah, it can. So, yeah, things don't always go to plan. It's just one of those facts of life. So, in terms of like what other people's responses were to you, did anybody say anything? Did anybody notice anything? I mean, presumably they will have seen this down here rather than this up there.
Yeah, definitely.
So
have noticed. Yeah,
Jimmy Hill, that kind of.
Yeah, my sister called that.
So apart from that bit, would you do that again?
Yeah, definitely. Yeah.
This section here.
Yeah.
And the upper part of the face.
Yeah, definitely.
It's sometimes hard, I think, to sort of separate things out for yourself a little bit because you see the whole.
Yeah, and I think also that's more of a drastic change, the bottom of your face, I think, than more than upper. And I think more now, I notice it more than anyone else. And I get quite self-conscious of it where other people say you look the same, really. So I think you start to overanalyse yourself.
And I think that's really important to say because I totally agree with you. People aren't looking at you in the way that we think that they are.
I know, yeah.
So I often say, when you're walking down the street after you've had a procedure done, if you're used to going outside, like wearing makeup, and then suddenly you're not wearing makeup, you can feel quite sort of self-conscious about it and like everybody's staring at you. But the chances are, they've got their own thing going on in the brain.
I know.
They don't care about you. They're wondering what they're having for tea or something.
I know.
Instead, it's kind of weird. And you were on one of our previous videos as well, weren't you?
Yeah, cheek fillers on the previous.
That was right. Yeah. Was that just here?
Yeah. That was really good. I really liked that cheek fillers. Really good.
Cheek fillers, I guess everybody always says that the lower face is the area that takes the longest to settle down. The chin specifically. You're the third person to say that to me.
Oh.
Out of 6.
Really?
Yeah. So. And we haven't had one of them back in yet.
But I must say before, I never would put my hair up because I felt my face was so haggy really. And now I wore it up for the first time the other day, and I felt good because I felt sharper around the jawline. So
that's great.
yeah,
and that's the kind of
Yeah.
thing that is really good to hear
Yeah.
after you've done
Yeah.
this sort of procedure.
yeah, because I wouldn't ever wear my hair up now, but I did now.
Well, that's the result.
Friday.
That's the result. Okay, guys, so that's all we've got time for this week. I hope you enjoyed the episode and found the story illuminating. Join me again in a couple of weeks where I'll be seeing another patient. I'll see you guys then. Bye-bye.
Bye.